Hi, Dr. Reagan Robertson, CCO of Productive Dentist Academy here, and I have a question for you. Are you finding it hard to get your team aligned to your vision, but you know you deserve growth just like everybody else? That's why we've created the PDA Productivity Workshop. For nearly 20 years, PDA workshops have helped dentists just like you align their teams, get control of scheduling, and create productive practices that they love walking into every day. Just imagine how you will feel when you know your schedule is productive, your systems are humming, and your team is aligned to your vision. It's simple, but it's not necessarily easy. We can help. Visit productivedentist.com/workshop. That's productivedentist.com/workshop to secure your seats now.
If you've got negative things to say it to me, okay? And most times if I bring this up to them, they'll go, oh my gosh, I'm so sorry. I never meant to do that. And they turn around. They become great patients because I address the issue immediately. Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way. It's just one that has worked extremely well for me, and I'd love to share that with you so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast. Hi, everybody. Dr. Bruce B. Baird here, your host of the Productive Dentist Podcast. You know, I just love having this opportunity to share my experience and knowledge with all of you here on this podcast. Dentistry can be a lonely business, but I don't believe any dentist should feel alone, which is really why I started this podcast. Last year, I was honored to learn that you voted me as one of the top 3 best podcasts of 2021 by dentalpodcast.org. And I'm excited to announce that I've been nominated again. And if you have found value in hearing what we talk about, I'd sure appreciate your vote. Head on over to dentalpodcast.org to vote for the Productive Dentist Podcast so others have the chance to learn about this podcast. Again, head over to dentalpodcast.org to vote for the Productive Dentist Podcast. And thanks so much for your support. This is Dr. Bruce Baird of the Productive Dentist Podcast. Today we're going to be talking about another one of my own risk factors that I added to John Coyce's risk factors, which I call the psychological risk or psycho risk. And what's important for you as a dentist is to understand that some of your patients are psycho. And I would like to find out who they are before I do a treatment plan. And who is a psycho patient? I mean, first of all, it's not the demanding patient. It's not those patients. It's the one who brings in a bag of 30 sets of dentures. It's the one who always has something negative to say about everybody. They have something negative to say about the kid who brought them to the appointment. They have something negative to say about their spouse, their life. They're sick all the time. They have, now some people, they just, unfortunately, they're sick all the time, but that doesn't mean I have to work on them. It doesn't mean that I have to work on every single patient that walks in the door. So how do I deal with that? Well, I think if you go back to the risk factors and the exam process, I want to make sure I ask questions, and I want to make sure I go through a certain protocol for my exam, which allows me to ask questions and to let the patient talk. Because letting a patient talk about what's going on in their mouth will start to give you a little bit of insight into what type of person they are, what type of personality. Now, I've had patients who were male or female who were very demanding with my team and who were rude with my team. And then I walk in the door and it's, oh, hi, Dr. Baird, how are you? And I used to just go, well, they just like me and they don't like you. But that's not what I do anymore. What I do now is I go, I I read the book called Crucial Conversations, an amazing book. But what it does, it kind of gave me the permission to have crucial conversations with other people, whether it be my kids, whether it be people I love, whether it be a new patient, whether it be a patient I've been seeing for years. But I call that the relationship type questions, meaning if you're going to hang out in our office, there's a couple things you're going to do. You're going to love my team because they're my family. And if you've got negative things to say it to me, okay? And most times if I bring this up to them, they'll go, oh my gosh, I'm so sorry. I never meant to do that. And they turn around. They become great patients because I address the issue immediately. What about the patient who just comes in and is talking bad about everybody? And my previous dentist was this, and then that, I went to this dentist, and I went to that dentist. Now, I'm not going to diagnose that person as being psycho, but I sure am going to perk up. I mean, they may have had the runaround in dentistry and gone to several different offices and never been given a good opportunity or good options that took into account their risk factors and all those things. So I'm not automatically just going to, put an X on that patient and send them down the street. But I do want to listen much more carefully to those patients. So when you hear a patient that begins the complaints and they start, what I do, and back in the day, I don't know how many of you ever listened, if you're older, you might have gotten Dick Barnes' 5 slides. He had 5 slides. You'd put them up on a little slide projector back in the day, and you'd show patients these different things. But he called those difficult patients, those psycho patients, he called them, he increased the fees on those patients, and he called that a heart, muscle, and stomach lining fee. And I can't remember what it was, but, back in the day, I would sit, and as I'm taking notes in the chart, and as we're talking, every time they would say something negative, I would just put a check mark in the chart. And every check mark equaled $100. So I would let them speak as long as they want to. Today, my check marks are $250. And we call that a reconstruction fee. And it's not covered by insurance. It's not covered by anybody except the patient. And I'll be talking to the patient and I'll say, Mary, we've been talking today and you have really had a run of things. You've really had difficulties from going to these different dentists and not having a deal, plus your health. And then you've got this other thing. Your case is extremely complicated. Obviously, you already knew that. And when I say obviously you already knew that, the patient always nods. Yeah, you're right. And I said, so what you're going to notice in your treatment plan is you're going to notice something called a reconstruction fee. Now, that fee is not covered by insurance, and it's really based on the difficulty of your case. You're in the right place. We do a lot of these cases, but that's what I wanted you to know, is that's what that reconstruction fee is. Why do I say that? Because when summer comes in, they go, the reconstruction fee on your case, the biggest one I've ever had is $13,500. That's a lot of negatives. But what happened? Well, the patient said, okay, I'm ready to get it done. Why? Because I listened to him, did the whole deal. And I told Summer to go back in and tell him that was just for the upper. The bottom was another $13,500. I didn't do that, but I wanted to. So I saw the patient. I did the work. Most times when I end up doing the work on those patients, it's never been worth it. I'm not going to say never been worth it. It is, there have been times where the patient has just become a great patient. I wasn't expecting. But mostly, if I pick them early, I pick them right. And had one patient, and this is what happens in dentistry, because every year, I think, don't you feel like you're getting better as a dentist? You're just getting better and better every year. Hopefully you do. I go to more continuing ed. I see things in the mouth that I never saw before because I just went to a course on grafting, or I went to a course on this, or whatever it is. And I had one patient, and she would come in, and I did a few implants, some crown and bridge work, and I had her precision partial made. And everything seemed to be pretty fine. She was a nice lady, but she came in about 2 weeks after we did it, and she says, I've got a sore spot. And I looked at it, and it was a little red, so I adjusted it. Then she came back a week later, says, I'm sore on this other side. Okay, and checked the occlusion with a T-scan, really evaluated the case very carefully, looking at it going, wow, okay. Then it got to be every day she came in. Every day I walk in, she's on the schedule. And I wondered, well, maybe she's just lonely and she just wants to come in because we've got a great team. We've got a lot of fun going on at the office, laughing, smiling, that type of stuff. Maybe she just wants to hang out. But this went on for like 60 days. And finally I'd had enough. So I went in, got the checkbook out, and I wrote her a check. I think the check was like for $12,000 or something like that. It was a whole lot of money. And I wrote the check, and it included every hygiene she had had with us, fluoride that she'd taken home with her, every penny she had ever spent in my office. I gave her a check back. And when I presented it to her, she said, oh, no, I don't want my money back, Dr. Baird. You've done a great job. I said, no. We really, I tell you, I just know I haven't. And she goes, I don't want to buy. No, I want you to have it. And I kind of stood her up, and then I handed her the check and I said, give me a hug. Give me a big old hug, because there's a friend of mine down the street I think that could probably get you fixed up. Of course, that's the guy that you really don't like down the street. Just kidding. But no, I'm not. So you send them down there with cash to go do the work. And I was so happy. I mean, everything was great. And I tell this story because of how 2 years later, she shows back up in my office. And she was having a problem. And me being the much better dentist than I was 2 years ago, because this was back in the day when I was taking responsibility for all of these wacko cases, she said, can you help me? And of course, being the better dentist, I decided, oh, well, of course I can help you. And we did some more dentistry on her, probably $6,000 or $8,000 worth of dentistry. I don't remember exactly. And she seemed to be doing great. Everything was good. And then she started coming in for adjustments again. And the only thing that worked with her was when you live in a town my size, we only get a newspaper twice a week. And I always go to the same place in the newspaper. And this is really bad on many levels, but I saw her in the obituaries. And I figured out that was the only time she was ever going to be happy with anything. And I was sad. But I think we had people, giving a fist pump, and which you should not do when someone passes away. But I will tell you that you're much better off identifying psycho patients before you start doing treatment on them. And I always think I can turn patients around. I always believe I can, with positive attitude, with positive, help, having a great team around me. And by golly, there's just some folks you just can't fix crazy, okay? And so the choice is yours. If you're gonna do those patients, identify them and jack your fee up, whatever you think it's gonna be worth. Now, if you're signed up with all these PPO plans and everything else, I don't know what the hell you do. I guess you have to see them, and you can't raise your fees. But I'd come up with some fee somehow, some way, to make that patient go, that's way too much. There's just no way I can do it. I said, I understand. Now, there's another guy down the street. He's pretty darn good at this, and he's less costly than I am, so you might want to go down and talk with them. So anyway, that's the psycho risk patient. That's the Dr. Bruce Baird psycho risk profile. And I hope you heard all that, because it's really important. Identify them before you start working on them. It'll make your life much, much easier. So that's the podcast for today. Look forward to the next one. If you have questions, you can email me at bruce@productivedentist.com. So look forward to next time. Thank you. Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.